Thank you for downloading Children's Pedcast, a conversation about pediatrics with Children's Minnesota. My name is Jimmy Bellamy, and this week my guests are Nicole Brown and Megan Shepard, a pair of physical therapists from Children's Minnesota, and we cover the topic of idiopathic toe walking. A lot of parents see videos of kids toe walking or will see stories about toe walking and then realize that they have noticed that their child does it too or did it, and oftentimes they think it's something that the child is doing that's just a little cute thing, or that the child is aspiring to be a ballerina someday, when really it is a concern that should be treated and can be treated here at Children's and in other places. Megan and Nicole see patients and their families pertaining to toe walking quite often, and they're here to talk about it. They'll answer a lot of questions that parents have, and they might even give you a lot of information that is completely new to you and will be extremely helpful in your own life and your family's life. So have a listen, and hopefully we're able to answer all of your questions. And in the episode, and then along with this post, you can find at childrensmn.org, we will have information on how to get a hold of Nicole and Megan, either for a research study that they're currently working on at Children's about toe walking, or to just ask questions in general about toe walking. And all of that you can find at childrensmn.org. And you'll find on our social media channels as well, our Facebook page, which is facebook.com/childrensminnesota, or Twitter @childrensmn. We're there as well. Find us on iTunes, rate, review, and subscribe to the podcast. The more you do that, the more we will be seen, and the more we can help people. So enjoy this episode on idiopathic toe walking with Nicole Brown and Megan Shepard. As soon as I saw this topic come up, I thought, okay, I've always heard it as toe walking, but idiopathic toe walking, is there a difference? Are there different kinds of toe walking, or what specifically is idiopathic toe walking?
Idiopathic toe walking is a condition in which children walk on their toes. It's sometimes known as tiptoe walking or toe-toe walking. The idiopathic part of that diagnosis just means we don't know why. There's no known etiology. That's not a notion that we subscribe to in physical therapy, however. We believe if a child is walking on their toes that they have a very valid reason for doing it. And we view it as our job in physical therapy to figure out what that root cause is and what that reason is.
When people are doing this or kids are doing this, is it a constant thing, or are they going in and out of it?
It depends. The kids that we typically see in the clinic, it is a constant thing. Some toe walking is completely normal. It's a part of normal walking development, a part of refining the walking pattern. What we do say, though, is if kids are walking independently, we want that toe walking to be gone within about 6 months of those first steps. So when kids are learning how to engage and activate and develop their muscles, they're kind of going in and out of toe walking, and that's the normal toe walking.
Megan, when should a parent be concerned if it's not resolved? And is it something that does get resolved on its own?
We see this a lot in the clinic. We have a lot of families that come in that say they've been concerned about their child's toe walking for a while, and that their pediatrician has just said their child will outgrow it. And we do see that. We do see that some toe walking is outgrown if it's just a normal part of ambulation and a normal part of the child refining their walking process and their walking pattern. When we want to see children in a physical therapy evaluation is if they're taking it more than 10 consecutive steps on their toes after the age of 2. That's when we really want kids to come in for a PT evaluation.
I think, too, sometimes people get confused because the kids walk on their toes, but then they're able to play with their feet flat on the ground. Their heels are on the ground. And so people don't think it's an issue, but if your child is walking consistently on their toes, that's when you really want to seek treatment.
If I'm a parent with a child who toe walks, why would I choose to have that treated early if they're toe walking early?
So the reason that we want to see kids early in a physical therapy eval is to really establish that root cause. Why is your child walking on their toes? And what can we do about it before it truly becomes a habit? Once it becomes a habit, and once the kids have walked on their toes for a few years, we start to see heel cord tightness. We start to see pain. The kids will trip and fall a lot. They'll have a hard time keeping up with their siblings or keeping up with their friends at school. The kids who come into the clinic who have been walking on their toes for a while typically have a more difficult time in sports. They're the kids that are begging to be picked up and carried at the zoo after about 30 minutes. So we want to get these kids in early to really make a difference and make a change in how they walk and how they move and how they're able to interact and play. A kid's job is play, and we want to make sure that all kids have the opportunity to do that as well as they possibly can.
When a child is in for that evaluation, what does it look like from the perspective of the physical therapist?
That's a great question. So we start with taking a developmental and a medical history. So as a parent, you can expect questions like, when did your child start walking independently? You can expect questions like, when did your child start crawling independently and how long did they do that? What percentage of the day is your child walking on their toes? So we look at developmental medical history. We look at alignment. We start at the foot and work up the chain. So we're looking at alignment at the foot, at the ankle, the knee, all the way up to the low back. We're also looking at lower extremity strength, so leg strength, but also core strength. We're looking at balance and coordination. And then finally, we're looking at gait pattern, which is GAIT, just as walking pattern.
What does the treatment look like for a child who walks on his or her toes?
Sure. So in the evaluation, we're looking at all these different aspects of the walking pattern and kind of balance and all those things. And so whatever we identify in the evaluation is kind of where we start treatment-wise. The biggest reason why we intervene with toe walkers is because those heel cords get tight. If you think of a child who's constantly on their toes and is walking with those heel cords in a shortened position every step, every hour of the day, as they grow, those heel cords are going to get tight. And so that's really why we intervene. With that intervention, we have some options as to how we treat that aspect of it. Kind of the options we think about as we're evaluating and moving into treatment are, 1, stretching those heel cords. 2, we can put casts on them to stretch them out. We also have a bracing option to stretch them out, and then a final option would be surgery to lengthen those heel cords. We kind of determine that by how the child's presenting in terms of how tight they are, and then how they're moving and their movement qualities and kind of the goals that the parents and the child have stated. What we've learned is that if the child is not very tight, stretching may work. But if they do have an established tightness at the heel cords, it just doesn't work long term to restore that walking pattern as they grow. And so most often we're looking at serial casting or bracing as the first line of defense. Serial casting, what that looks like is they get 2 casts put on, so 1 on each leg. They are kind of lower leg casts, and they're put in walking boots, and they get new ones every week for about 6 to 8 weeks until that range is restored. So we give them cast boots. They can run, jump, kick, dance, play soccer. I mean, these kids can do everything in their cast. But we do know that this is a great way to establish that normal range and kind of get us moving on establishing that normalized walking pattern. So the biggest restriction, though, we have with casts is that you can't get them wet. So sometimes in the summer or, some kids, it's just not an ideal option. And so we've kind of developed a brace here at Children's that is set to mimic the cast. And so it's a carbon fiber brace. It looks a lot like the cast. It's still on the lower legs, both legs, but it's custom to the kids' feet. And they wear this. They can wear it in tennis shoes or cast boots. And this will stretch out their heel cords for us and get us going on our goals.
Is that removable day to day?
Yes, so you can remove that, so it's easier to take showers and those kind of things in that. We do have them wear it 23 out of 24 hours a day, though, so they sleep in them as well. We've just found that if it's any shorter than that, we just don't get the range of motion we're looking for. And so typically they, you can choose what you want to take it off for that hour, but some people take it off for their shower, some people take it off for, soccer practice or those kind of things, but it gives you a nice option.
Are there any lingering or long-term health impacts with toe walking, even if somebody has it corrected? Are there things down the line that they can be dealing with that someone who doesn't deal with?
As we're dealing with kids, they're constantly growing, developing, and certain ages they grow quicker. And so if their heel cords are tight, they are going to find a way to get their heels onto the ground. We're either, as adults, we're telling them to walk on their heels constantly, and they are trying to do that for us. Otherwise, just a stability factor, it's much easier to stand, to balance, to do things if you get your heel on the ground than it is to stand on your toes all day.
Correct.
And so they do get their heels down, but the ways that they do that are by compensating at a different place. And so sometimes the child will point their toes out, sometimes they'll roll their feet in and have more of a flat-footed presentation. Sometimes they stand with a really wide stance. And so you'll see this in some of the kids that you may know who are toe walking. And if these compensations remain for a long time, we see some skeletal breakdown. So you can get some changes at the knee, you can get some changes at the hip. The majority of the changes we see are at the foot and the ankle, though. So that midfoot, that arch that we talk about always trying to support, well, that usually rolls in and those bones kind of collapse down to the floor. And that's what we want to prevent, because once those bones start falling down to the ground, there's not a lot we can do to fix them. And so what that means long term is that now they don't have a shock absorbing structure about the foot. So every time they're running and jumping and playing, now it's just kind of those lower legs, the back, the hips are taking a lot of body weight and force through them because there's no longer a shock absorption at the foot.
Well, and I see that with our older patients, with our teenage patients who come in with a lot of pain, they'll actually start having plantar fasciitis symptoms early on from the way that midfoot is collapsed. And that midfoot collapse is the most common compensation for tight heel cords.
So then are there things, are you looking at a lifetime of dealing with special inserts in shoes to make up for that?
Potentially. Absolutely. We also see, kind of as we move up the chain, one of the compensations is that kids will come on their flat foot. I mean, I appreciate Nikki saying what she did about kids trying so hard to please us, and we are constantly nagging them, as therapists, as parents, as teachers, walk on your flat feet, and they can for a couple steps, and then they're right back up on their toes, and it's very hard because they truly have no control over that, and so those children that do end up coming down and trying very hard and coming down and compensating up the chain have the potential also for shifting their weight really forward in their trunk and having some breakdown at their lumbar spine, which, results in a mechanical low back dysfunction in adults. And the core muscles are turned off in that situation when you're standing compensated like that. So it has the potential to cause problems as kids get older and taller and heavier and then become young adults.
Is there something neurological in this when the child can do it for a few steps? Is it just reverting back because the brain has been trained to walk that certain way for a while?
There is a neurological toe walker. We think of our most classic example would be cerebral palsy. You do see kids with a neurological condition walking on their toes. Some kids with sensory also walk on their toes. And so our population definitely doesn't have a known neurological, but the brain has learned since they started walking how to fire muscles in a toe walking pattern. So that brain, spinal cord are firing in a toe walking pattern. And so that's where PT comes in. We come in and we kind of start head to toe treatment and rebuild strength, establish normal range of motions at all of our joints. And then we start working on balance, and then we start retraining that walking, and it takes a while, and it takes some, very repetitive practice to start rewiring that to fire in a heel-toe pattern.
Okay. Tell us about some of the research you two have been a part of here at Children's, and any of the information that people listening, parents, could know or even take to be a part of this.
Sure. So right now we have a randomized controlled trial going on at Children's. And so the randomized part is we are testing the braces we designed. And so serial casting, we have established through previous research, that it works. We've been using the braces for years now at Children's, and we've observationally seen that they work, but now we are testing so that we can have the data to support that. So those are the randomized. So if somebody wants to be in the study, they would be randomized into a casting group or a bracing group. And so from there, what we're looking at is just a lot of different aspects of toe walking in general. There's been a lot of great research coming out recently around toe walking because historically it wasn't a well-resolved treatment diagnosis. We just didn't have great results on it. And so there's been a lot of research coming out, but there's still a lot of holes. There's still some things that we don't know. And so what we're doing is we're testing a lot of different areas to see if we can predict success or predict how we should treat or when we should treat and get a little bit more precise data on those.
I'm curious to know what you have seen as PTs in this social media age. Based on what I've seen in the activity of the past 2 years, anytime we've had a blog post on toe walking or anything in the realm of social media, a lot of people will comment saying, I thought my child was being cute, or, oh, I didn't know this was a thing. Or you'll see almost this community come out of this group of parents not knowing that, oh, wow, there are other people doing this, or there are other kids doing this. Have you seen a rise in that in, like, just say like the last 5 years? I mean, 5-10 years, we've seen a lot of social media activity. Seems to ramp up year after year, but has there been an increase in patient-family visits for this area?
Absolutely. YouTube is a great venue for watching videos of children walking on their toes and being wildly entertained as a physical therapist. I teach a course at the university, and I'm always looking for YouTube videos to show my students examples of just children in their homes walking on their toes, and the comments from parents or the presentation from parents about this is a problem or this isn't a problem is fascinating. And I think we have seen a ramp in that, especially in the social media age, because we have so much more access to it. And I know at Children's we've had a lot of interest in the toe walking blogs and posts that we've done in the past and things that have been on the Facebook page. And that's fantastic because it's opening up a dialogue and it's starting a conversation. And we want to see these kids in therapy. We absolutely want to see these kids in therapy, determine if it is a problem, we do need to do something about it. It's so much easier if we can start early on, before kids are allowed to get into that habit and rewire their neurological systems.
Is there anything that you can think of that would be akin to this in the health field, that a person could think it's something that's cute when it's really a concern?
We see this a lot with torticollis, which is infants with the wry neck, where they are born with a tilt, and they look very cute in pictures because their little heads are tilted to the side, but it's actually a muscle shortening, and it's a problem, and it can lead to plagiocephaly or head flattening, and it can lead to decreased motor skills and gross motor development. So those are children who also need to come in for physical therapy evaluations.
Our research in the physical therapy world has improved significantly in the last 10 years, probably around this diagnosis. But the whole medical field is catching up. And so, we still get I mean, a lot of my patients that come in, they're like, oh, we didn't really know this was a problem until we saw this or we read this. And so I think it's just helping people be more informed that there are physical therapists who do treat this conservatively. And, they can come in and seek that treatment.
One thing I think we all could agree to stress with parents is that as parents, you have so much going on. You have so much to worry about. It's nice to be able to reassure them, though, that this isn't something you did wrong. There's nothing in your parenting that led to this.
Absolutely not. There, like Megan said before, there is a reason that these children chose to walk on their toes. It's not energy efficient, but there was a cause, and it's okay. If you don't notice it for a while, you're worried about other things, development and health and learning, and there's a lot of things that happen early in development, and we totally understand. And at any point, if you guys want to come in and get it checked out, that's okay. And
are there ways parents should reach out if they want to be a part of the study we have at Children's?
Absolutely. They can contact me through telephone. My number is 950-8685. Otherwise, if email's easier, my email address is nicole.brown, like the color, at children's, with an S, mn.org.
Great.
So, and I'm happy to answer any questions you might have. Really, if you have concerns, sometimes it's nice to go to your primary care provider and start there, and they can always refer you to physical therapy. But if you have any initial questions or about toe walking or about this study, I'm happy to answer them at any time.
We've talked a lot about physical therapy with two PTs here present with us. Are there any other areas of therapy that are involved with idiopathic toe walking?
So, Jimmy, when we're trying to get to the root cause of why a child's walking on their toes, we're looking at the sensory system. And a lot of our kids that come in for PT evaluations, we identify as having a sensory processing issue. And we have experts in the sensory system, our occupational therapists or our OTs, and we call on them quite a bit, and we refer to them quite a bit to help us get to the root of the problem. Because we can treat tight heel cords, we can treat weak legs, we can treat weak core, we can work on balance and coordination, but if we aren't getting at the root cause, we're just treating symptoms, and we're not truly helping resolve a toe walking condition. The other strong correlation with toe walkers is a speech delay. So if that's an issue, we can certainly help you get a referral for speech therapy for your child as well, if that's something that's needed.
Is there an average time that the process takes from coming in to see you the first time to being deemed toe walking free?
This is a long process. Sometimes when we're starting out, it's kind of a shock initially, but typically what I tell people is it's going to be about a year from start to finish, where we can retrain that walking and it's successfully gone. Sometimes our kiddos who have a sensory component to it, sometimes they need a little bit more follow-up as they grow, but otherwise, we get pretty good resolution in that year. If they're casted, usually it's about 6 to 8 weeks, and then they're in another brace for sometimes 2 to 8, 9, 10 months. It just depends. So when they're in that brace, it's kind of the process it takes to retrain that walking to completely resolve the toe walking. If we take them out too early, the toe walking will come back just because that's still firing in that pattern. And so they stay in those braces until it's completely resolved. And once it's resolved, then we're finished with physical therapy.
If a parent is at home and is witnessing his or her child walking on his or her toes, and you could be there next to them when that initial concern sets in, what would be the thing you'd tell them?
I think I would just tell them that it is okay and that there's people out there that can help your child, and we can fix this before it even becomes an issue where they're having trouble keeping up with their peers, or they're having pain when they're at the zoo walking and they can't get to that exhibit because they're in too much pain, or they just choose to read instead of be active, or they're falling all the time. So we can help, and if we're not the first line of defense, we can help you get where you need to be. And so we are willing to help in any way or answer any questions along the way that you have.
We're fortunate here to have 2 hospitals, a dozen clinics. We have a surgery center. We have a number of places around the metro that are children's focused. Where is the actual rehabilitation for toe walking taking place?
So we have physical therapists as well as occupational therapists and speech therapists at our 2 main hospital sites in St. Paul and Minneapolis. We also offer serial casting at those 2 sites. We have rehab services at clinics in Roseville, Woodbury, Minnetonka, which also has serial casting, Maple Grove. Did I miss anything? Nope, that's it.
And you can look at the links that come along with this podcast at childrensmn.org. We will have Nicole's number, email address, as well as all of the links to the locations that Megan just mentioned. Nicole Brown, Megan Shepard, I can't thank you enough.
We appreciate being here.